Good afternoon. Thank you for joining us. We decided to try something new this year. This is not only the first webinar we are hosting in this format, it is also the first time we're going to break down the high deductible health plans, which we'll refer to as HDHPs, and health savings accounts, which we'll refer to as HSAs, from the Los Rios employee perspective. We're hoping our customized approach and real life experiences will make HDHPs and HSAs a little more exciting. Now we'll get started by introducing ourselves. I am Jamie Ruggles, the Director of Accounting Services.
I'm Nicole Keller, the Employee Benefits Supervisor.
And I'm Paul Harris, Information Systems Auditor.
Now a few housekeeping items. We do have a chat box available for questions and technical issues. We have a few IT techs out there available to help you with your technical issues through the chat box. We'll also do our best to answer any questions that you have for us at the end of the presentation, but feel free to contact one of us directly if we don't have time to get to your question. I also wanted to let you know that we are recording this presentation and plan to have it available on the Employee Benefits website soon after the presentation. We know a lot of you will want to share this information with your spouse or domestic partner, so we will try to get posted as soon as possible. With all of that said, we'll let the fun begin. So, as we stated, this presentation is on high deductible health plans and health savings accounts. Okay. We do not provide any tax, legal, or accounting advice. This material has been prepared for informational purposes only and is not intended to provide and should not be relied on for tax, legal, or accounting advice. You should consult with your own tax, legal, and accounting advisors before engaging in any transactions. We also want to mention that all of your benefits and eligibility for benefits information, and you should look at the terms and the contracts of your benefit plans, including the group insurance contracts and employment contracts and policies for information regarding the benefits. So let's start out with some of the high deductible health plan basics. So what is a high deductible health plan? It is a plan that has a lower monthly premium than a traditional HMO. And one of the things to mention is that most of our Los Rios high deductible health plans for full-time employees have a zero out-of-pocket premium for the employees and also include a contribution to the employee's health savings account. But on the flip side, those plans do include a deductible, and your deductible does reset to zero each year on January 1st. And to mention that our traditional HMO plans do not currently have any deductibles. So I'm going to show you some more information and will help understand that. But with the basics, lower monthly premium, but it does include a deductible. Premiums. Premiums are the amount that must be paid for your health insurance. So either you or your employer pay that amount, and or your employer pay those amounts to the carriers. Another important concept in a high deductible health plan is a health savings account. Paul is going to go into a lot of detail about the health savings account later on in the presentation. Okay, so what I wanted to show you here is an example of what you saw in the open enrollment email that I sent to you yesterday. This is just an example. You want to look at your specific unit for the actual premiums and contributions that are specific to your unit. But I just wanted to show you how to read this and help you to be able to compare the different plans. You'll see in the top boxes up there, those are your traditional HMO plans and the DHMO plan. And you could see, for example, Kaiser's HMO plan. The total plan monthly premium on that specific Kaiser HMO plan is $1,522. The district contributes to that plan $1,274. The difference there is the $247. That is your employee monthly contribution towards that premium. So that's how you read that table up there. Then the bottom set of boxes, the bottom box down there, those are the high deductible health plans. So you could see first when you look at the Kaiser's high deductible health plan, that plan's total monthly premium is a lot lower than the Kaiser HMO premium at $980.16. You could see that the district contribution toward that premium covers the full premium, which means that the district is covering the entire premium for that plan, and so the employee monthly contribution is zero for that. You could see that there's still enough money left over for the district to additionally to contribute monthly to the employee's HSA account. So that's that health savings account. You could see if you're an individual, then the district would contribute $100 towards your health savings account. And if you're a family, the district would contribute monthly $150 towards your health savings account. So I must mention that as long as you are eligible to contribute to the HSA and an account is already established with Basic Pacific. Once again, Paul will be going into more details regarding this. So now circling back to deductibles and what a deductible is. A deductible is the amount that you are going to pay for covered services before your plan is going to start to pay. So for example, if you have a $3,600 deductible, you pay for the first $3,600. So an example would be is on a traditional HMO plan, you go to the doctor and it's for a non-preventative service, you would just pay your copay, you would pay $15. If you're on a high deductible health plan, you would pay for the full cost of that service, whatever that cost might be, up to your deductible of $3,600. So one thing to mention though is that all of our Los Rios plans pay the full cost of most preventative services. So your regular annual physicals, your wellness, your wellness visits and things like that, those are covered with no out-of-pocket costs. Okay, so included on the employee benefits website in the link that I sent to you yesterday where you get your guide in the open enrollment email, there's a link where you could go to My Benefits and you can actually go in and select different Los Rios plans to be able to compare them side by side. So that's where I got this information down in that picture below. What I did is I took all three of our high deductible health plans and compared them side by side just to be able to demonstrate some of the specifics related to the high deductible health plans. So you could see down there that there's a box for Kaiser, Sutter Health, and Western Health. And you could see there that the deductibles there for each of the plans and the deductibles for the family plans. So you could see there that the different deductibles for each of the high deductible health plans. So one of the most confusing parts related to these deductibles is how a family plan deductible works. And because each family member has an individual deductible and the family as a whole has a deductible. I have an example from Kaiser that goes specifically into how this works, but I wanted to show you this here as well. So Kaiser, for example, an individual in a family plan has their own deductible of $2,700, and then the family as a whole has a $3,600 deductible. So once an individual pays $2,700, that individual only pays co-pays, but the rest of the family will pay the full cost of their services until they spend $900 more, which will get them to the $3,600 family deductibles. An individual is a little bit easier. So if you're on your own individual plan, your deductible is $1,800. But that's one of the things that makes this a little bit more confusing. So I thought I would add in a slide here just to explain that a little bit more. The next area here is the out-of-pocket max. That's the most that you are going to pay for covered services in a plan year. So once you reach your maximum out-of-pocket, your plan pays 100% of the cost of the covered benefits. So you could see down there, once again, I have each of the high deductible health plans, and highlighted there is the annual out-of-pocket max for an individual plan and for a family plan. Once again, I wanted to highlight the confusing part of this, which is how the out-of-pocket maximum works for a family plan. So it's similar to how a deductible works. Each family has an individual out-of-pocket, and then the family as a whole has an out-of-pocket max. So once again, Kaiser, for example, an individual in a family plan has a $3,600 out-of-pocket max, and then the family as a whole has a $7,200 max. So, what do you pay after you reach your deductible, but before you reach your out-of-pocket max? The answer to that is copays. Now, this is where our plans are different than maybe some of the other plans that you are going to see out there. Because with our current high deductible health plans, you only pay copays for the following. For Kaiser, you're only going to pay copays for most prescriptions. For the WHA, you're only going to pay copays for brand name prescriptions. And for Sutter, you're only going to pay a $50 copay for admittance for inpatient hospitalization. Everything else, once you reach your deductible, is 100% paid for by the plan. So that is something that is different that with our high deductible health plans that is often missed, is that once you reach your deductible, the plan is going to pay for everything else except for those items that I have listed down there below. Once again, I took snapshots from that My Benefits Compare that shows you exactly what you're going to have to pay for once you reach your deductible for each of the plans. You could see highlighted there for Kaiser, it's most of the prescriptions there. Western Health Advantage, you're just paying the copays for the brand name prescriptions there. And then Sutter Health plan, like I said, you're just paying for inpatient hospital services. So what the difference is coinsurance. So coinsurance is a percentage of cost of covered services you pay after you paid your deductible. We do not have coinsurance. So that is where our plan is different, is once you pay your deductible, you do not have any coinsurance. You only have copays on those limited items that I showed you on the slides before. I think that's a very important distinction that I can't emphasize enough of the difference in our high deductible health plans compared to other high deductible health plans that your friends might talk about and what might steer them away from their high deductible health plans because of that coinsurance. Could be sometimes 20% of the costs, where you're paying zero of the costs except for those items that you have to pay copays for once you reach your deductible. So in summary, this kind of summarizes everything that we've talked about so far. You pay the full charges for the covered services until you reach your deductible. Once you reach your deductible, you pay the copays for the prescriptions for Kaiser and WHA and the inpatient admits for Sutter Health Plan. After you reach your out-of-pocket max, you won't pay for any covered services at all. So this is an example that Kaiser gave to us that is specific to our plan design that I thought that I would go through. So you could see here, Cameron and Savannah are enrolled in the family coverage on an HSA high deductible plan, so the Kaiser's high deductible plan. They're expecting a baby, and each of them have prescribed medication. Okay, so for covered non-preventative services, they're going to pay the full charges up until they reach their deductible. So you can see on the first line, they have 2 annual physical exams. Both of those physical exams are considered preventative services, so there's no deductibles, no copays on any of our plans for those services. So there's zero out of pocket for that. Then Savannah has some prenatal care exams related to her pregnancy. Those are considered preventative services as well. And so there is zero out of pocket cost for Savannah for those charges. Then you could see that they have some prescriptions. You could see that Cameron and Savannah, they haven't reached their deductible yet, so they are going to be paying the full cost for those prescriptions until they reach their deductible. So you could see that Cameron's cost for his prescriptions are $744, and Savannah's costs are $330. Then Savannah needs to get a prenatal ultrasound. This service is subject to the deductible, so she's going to pay the full cost of that service, which is $522. Then she has to go to the hospital to have the baby. The charge for that is $1,848 that she is going to pay. At the end of the day, after she has the baby, her total costs so far are $2,700 for Savannah. So Savannah has now satisfied her individual deductible. So now for the rest of the year, all Savannah is going to pay for are copays. And remembering she's on Kaiser, so the only copays the only thing she's going to be paying for now are going to be prescriptions. And she's only going to be paying for prescriptions until they meet the family out-of-pocket max. But Cameron and Savannah still have not met their family deductible of the $3,600 because they're only at $3,444. So that means that Cameron still needs to pay an additional $156 in services before they reach their family deductible. After that, both Cameron and Savannah would only pay copays for their prescriptions. So what we're going to do after, we're going to go through an example that goes through this a little bit in more detail using our calculator. But for now, we're going to move on to Paul, and he's going to take us to a more exciting part of this presentation, which is the health savings accounts.
I agree. HSAs are my favorite part of the high deductible health plan. So what if the federal government designed an account that could help district employees kick monthly premiums to the curb, enjoy fabulous federal tax benefits, pay for your medical, dental, and vision expenses like a boss, and be the envy of all your friends in retirement? Well, they did, and it's called a health savings account. So an HSA is a federally tax advantage account that you can use to cover qualified healthcare expenses today, tomorrow, and in retirement. So my favorite piece as a CPA is the tax portion. And so from the tax advantages on the federal side, it's actually triple tax advantaged. So any contributions to your account go in without income taxes. Any earnings you make on those contributions, there's no income taxes. And any distributions you take that are for qualified healthcare expenses, there's no taxes on those distributions. And as an added bonus, if you make your contributions to that account through payroll, those contributions are exempt from both Social Security and Medicare taxes. So that if you're subject to both of those, it's a combined rate of 7.65% that you're not going to have to pay. But in California, there's a caveat. California is here to rain on our tax-free parade. So like one other state in the country, California treats HSA accounts like any bank account, any brokerage account. So any contributions you make and any earnings you make on your contributions to your HSA, California will take their piece up front. But once you pay the taxes, you can withdraw those funds. Just like a bank account, you can take it out for whatever reason. It doesn't have to be for qualified medical expenses. So we now know what an HSA is, but what is a flexible spending account, which many people are familiar with. They're familiar with the term flexible spending account. Well, an FSA is a tax advantage account that can be used to cover qualified healthcare expenses. So you may be thinking, isn't that the same thing as an HSA? Absolutely not. And here are some fundamental differences between the two accounts. So with a HSA, the funds belong to you. You own the funds. Any funds that go in an FSA, they belong to the district until you use them for eligible healthcare expenses. And then how long are the funds available in your account? Well, any funds you contribute or the district contributes to your HSA, they roll over year to year. They don't expire at the end of the year. It's not use it or lose it. Any funds you put into FSA, you need to carefully estimate what you're going to use, because if you do not use it, you lose it. And then a third main difference is, do your funds earn interest? HSA funds, yes, they can earn interest. You can keep them in an FDIC safe account. Or once you get, for the district's particular HSA, once you get above $2,000 balance in your account, you can then invest it in various mutual funds. So you can be as conservative or as risky as you want to be within those investments, depending on your risk tolerance. And FSA funds, no, they don't earn anything. They just sit there for the year, and if you don't use them, they're gone. So, and hence the spoiler alert, the HSA wins by a mile. So another benefit of the HSA is that it can be used as a retirement tool. So you don't have to use your HSA to pay for your current medical expenses. So if you have a really good year, you don't spend that much, you go for your preventative visits, you don't spend that much, you have maybe one more visit, you can leave all those funds that the district contributes and you're contributing in your fund, in your HSA to grow. So if you don't spend it today, you can spend it, you can hold on to those receipts and you can reimburse yourself 30 years from now, 40 years from now, whenever the case may be. There's no expiration date on when you can reimburse yourself. And those will always be tax-free reimbursements unless, unless something changes in the future, but for now, they will always be tax-free. And then there's no fear of overfunding your HSA, because once you get to be 65, if your medical expenses don't materialize like you might expect them to, then it becomes much like a traditional IRA or a 403B. You can take those funds out, but you'll just owe federal income taxes on them if they're not for qualified healthcare expenses. I'm going to hold on that slide for a second. So for the average individual, your healthcare costs, they vary each year, but they tend to rise as we age. So an HSA coupled with one of our high deductible health plans, it can provide a tool that allows you to shift a portion of your healthcare dollars to future years. And my personal goal would be to be able to retire when I'm 55. Whether I do or not is a different story, but I'd like to be able to have the option at 55. And so one of the biggest expenses when I retire would be those medical premiums that I'm going to continue to have to pay. And especially if you retire before you are eligible for Medicare at 65, if you look at the district's retiree medical premiums, you might be in for a bit of sticker shock. And that's because now not only are you responsible for paying your portion of the premium, but you're going to be responsible for paying the majority of what the district paid while you were an employee of the district. So my personal plan is to use the HSA funds that I accumulate right now to be able to use a high deductible health plan in retirement at a much lower premium, and then I can use the funds that I've accumulated to pay for my deductible expenses. And then once I become Medicare eligible, I can then use my HSA to pay for my Medicare Advantage premiums through the district's plans. So I just want my final thought on that slide is that if you utilize one of our high deductible plans with an HSA during your working years, it'll be much easier to stay on that plan once you retire. So how much HSA goodness do you get each year? Well, if you're an individual, if it's just you that you're covering, you can contribute up to, you and the district, your combined contributions can be $3,500. And if it's you plus however many are in your family, you can contribute a total of $7,000. So if you have an HSA and then your spouse has an HSA through their employer, you don't get 7,000 times 2. You get 7,000 total. So that's the maximum that a family can contribute to an HSA during the year. So unfortunately, there are some people that won't be eligible to open or continue to fund an HSA. So the first criteria is that you have to be covered by a high deductible health plan to open an HSA. And you can't have any other non-high deductible health plan medical coverage. So this is, if you thought that you would go on your spouse's health plan, they have a traditional plan, and you're going to go on the HSA, so you don't have to pay premiums, that's not allowed. You can't be covered under any other non-high deductible coverage. And if you're over 65 and you're going to be enrolling in Medicare, you can't contribute to or receive the district's contribution 6 months prior to your retirement. And to go along with that, you can't be enrolled in Medicare. And you can't be claimed as a dependent on anyone else's tax return, and you can't participate in a medical flexible spending account. So those are there's a few instances where you won't qualify, but it's not if you don't qualify this year, you may qualify next year, and there are steps that you can take to ensure that you qualify in the following year. And now I'll turn it over to Nicole.
Okay, thank you, Paul. So thus far, I just wanted to provide a quick recap. What Jamie touched on was she referenced the medical plan structure, also known as the High Deductible Health Plan, or HDHP. Whereas Paul gave more of a technical review on the Health Savings Account, or HSA piece. So those two pieces work together to provide this benefit that we're talking about today. I know in our office with many of the acronyms that are flying around, it can get a bit confusing. So I wanted to start there before I go forward and just explain the differences between the two and reiterate that. And at this point, you are probably wondering whether or not a high deductible health plan is the right option for you and perhaps your family. Before you make that decision, there are some important questions to ask yourself. And I think you've probably noticed that Paul is a bit excited about the health savings account, as is Jamie, and I, of course, share in that excitement, but I have a little bit of a different approach toward it because I am in a bit different family situation than perhaps either of them are. So as I go through some of these examples, I am going to relate them to myself and my family structure and some of the expenses we've faced, and I hope to do so to provide you kind of with the context and all the possible scenarios, and perhaps you might be sitting listening, sharing in some of these stories. So first, am I likely to avoid seeking medical care if I am responsible for paying the full cost up to my deductible? If you are somebody who's considering this shift, and perhaps you are currently enrolled in an HMO, a traditional HMO, if you will, you are really going to have to experience a shift in your mindset from the traditional HMO thinking. Rather than your costs being anticipated before you go to the doctor, in other words, currently I know if I take either of my sons to the doctor, for example, I am going to be charged a $15 copay regardless, assuming that that's for a non-preventive service. Now, assuming I switch over to a high deductible health plan, that same visit could potentially cost $180, again, assuming a non-preventive visit. So it's a shift in mindset in that, am I okay with not knowing what that cost is up front and perhaps not being able to plan really exactly accordingly. Now, I will also say that each of the carriers on their websites do have various cost estimating tools. So it would be advantageous to do a bit of homework, and that looking at typical visits that perhaps yourself and or your family may need in a given year, and take a look at what those visits might cost based upon the three carriers. That would be one of my concerns specifically in having two young children who do access services quite frequently. I know that those costs can add up. Which leads us to, do I have access to enough funds to cover the cost of my deductible from day one? That means on day one of the plan, so let's say I personally make this shift, and on July 1st, I change over to a high deductible health plan. And let's say, for the sake of argument, that on July 2nd, perhaps the more injury prone of my two sons is injured and has to seek services, and then let's say, for example, that we reach the deductible. Again, hypothetically, that could happen on July 2nd, as I referenced, because I have to reach the deductible by the end of this calendar year. Because I'm coming midway through in the plan year, I may be responsible for that deductible right away. So there's a bit of risk associated with this change, because I now am subject to something I hadn't been before. And then you've got to also consider that if you're unable to pay this amount, so that full liability amount, let's say the deductible, you'll need to work out a payment plan with the carrier. And that's definitely something to consider. Payment plan options may also differ by carrier, so it might also be advantageous to find out from each of the carriers how that works and what that structure looks like. before we continue, I also just wanted to add that as I referenced having to pay potentially the full deductible for the remaining 6 months of the calendar year, assuming I make the change over to this plan, the first year that you are enrolled is what we really define as being the most risky, in the sense that because the deductible operates on a calendar year basis, on January 1st of the next calendar year, so let's say January 1st of 2020 now, I would again be subject to the deductible for next calendar year. So this is unique, and it's the only year, that first year that you make the switch is the only year then that you could be subject to potentially 2 deductibles. So I suppose what I'd ask myself is, am I unlucky enough to be in that situation in the first year? And if I was, would I be able to cover that during this period of time within which I don't have any HSA funds built up to draw from? And I'll touch a little more in just a minute on why I may or may not have HSA funds built up.
And if you got a little lost there, because that is something that is confusing with this too, is that first year. We have an example that I'll go through in just a moment that shows you that first year risk.
Okay, so continuing on, as I mentioned, a shift in kind of mindset about your health plan. How much value do I place on simplicity? So I assume by now you're probably thinking that a traditional copay plan is the simplest option. Cost of a covered service is known up front, and it's usually your copay. In other words, you go to the doctor and you can anticipate, for example, a $15 copay for most visits. You can anticipate those costs and plan accordingly. It's really a matter of more so paying in the form of a monthly premium rather than paying at the point of service as you would if you switched over to a high deductible health plan with an HSA. Going forward now, how much medical care do I and or my family typically require? So you're more likely to reach your deductible each year if you and your family or perhaps frequently visit the doctor or have various health conditions. So that's definitely something that you want to consider when you're doing the math and trying to determine whether or not this might be a viable option for you. You want to look at how much you're spending, quote unquote, in services, how much those services might cost, and what a typical year looks like for you. Of course, there may be things that come up that weren't anticipated, but looking at a typical year will really give you the best estimate. Keep in mind, if you do switch over to a high deductible health plan, those premiums are not coming out of your paycheck. Moving on. So the best option in terms of looking at whether or not you will make this switch is analyzing your risk versus reward. You'll really want to compare a traditional HMO to a high deductible health plan using all of the guidelines that we've just mentioned. Of course, if you were to make the switch, you'd be saving in monthly premiums each month. You would also be receiving potentially receiving a district HSA contribution to be used toward future medical expenses. And then you would also be receiving the tax savings that Paul mentioned. You'll of course also want to analyze your risk versus reward. So there is a definite upside opportunity, but at the same time, as I mentioned, there is some downside risk. And a lot of those relate to some of my own personal concerns, using my sons as the examples. Moving forward, I am going to review the next slide. Actually, it's almost as if this slide was written for me. This is my situation, and so I think that providing the context of myself might make this a little bit more clear. So if you're somebody who participates in the flexible spending account for the calendar year 2019, which I am currently participating, and let's say, for example, that I wish to elect a high deductible health plan during the open enrollment that just started, effective July 1st of 2019. So I'm somebody who last fall decided to enroll in an FSA, and honestly that's because I hadn't really considered moving to a high deductible health plan at the time, having two small children. Because I hadn't anticipated doing so, I enrolled in the full medical flexible spending account. Now, as I consider whether or not a high deductible health plan might be a viable option for me, I realize that I can't fund the HSA until January 1st of next year. That's because you can't have an FSA and an HSA at the same time. The IRS has decided that that is double dipping, so to speak. You can't have one with the other. Therefore, from July 1st of 2019 until the end of the year, I am not allowed to contribute to my HSA. So you may be thinking, that really puts me at risk because I'm subject to that full deductible on July 1st and until the rest of the calendar year, but I don't have any HSA funds to draw from. So moving forward into the year, my balance in my FSA has to be 0 by the end of the year in order to set up and then start funding an HSA on January 1st of next year. So from January 1st of next year of 2020 until June 30th, I could start funding my HSA. Caveat to this is if your FSA account balance is not 0 by the end of 2019, you have to wait until the first of the month following the grace period. So you would have to actually wait until April 1st of 2020 to fund your HSA. True story, I had somebody last year who left $1 in their FSA, and because of that $1, they were not able to open up and fund their HSA until April. So word of caution there, make sure that the HSA, or the FSA, I'm sorry, has been exhausted. That's really important. Another question that we often receive is, let's say me, for example, my FSA is actually almost gone. It doesn't matter. I'm still enrolled in the FSA for this year, so I can't suddenly switch to the HSA on July 1st just because my FSA has been depleted. Keep in mind that you may be able to use your FSA dollars to reimburse yourself for medical costs incurred with a high deductible health plan. Now, had I last fall thought that I may be making this switch, what I should have done was enroll in the limited purpose FSA. The limited purpose FSA is limited to dental and vision expenses, so you can't run medical expenses through that plan. But with that, then the IRS would not view me as basically double dipping in the medical, on the medical side of things, and I could still use some of my other expenses and run them through that account. So if there is somebody who's perhaps in that situation, that might be something to think about there.
Something to mention is that on January 1st, 2020, when your FSA account is 0, you can catch up with your employee contributions. So you could change your HSA contributions to be able to catch up for those 6 months to be able to get those contributions. But your employer contributions wouldn't start until January 1st, 2020. So you'd be losing no matter what the 6 months worth of employer contributions to your HSA, but you could catch up with your employee contribution to your HSA.
Keep in mind also with those contributions, we have what's called an HSA change form. That form you can complete and change your contributions at any time, just knowing that the change wouldn't take effect until the end of the next calendar month's paycheck. So you want to really be diligent in your planning. If, let's say, for example, you're trying to max out for a calendar year, you want to just be mindful that when you return a completed change form to our office, the change would take effect the end of the next calendar month. Moving on, how to make the switch and how to actually set up an HSA. So what you would first want to do, particularly if you're doing this right now, is you would enroll in the high deductible health plan, which is, again, the medical component. So you're enrolling in the medical plan right now during open enrollment before the May 24th deadline. Complete the applicable enrollment form, whether you're looking at Kaiser, Sutter, or WHA's high deductible health plan. Return that original completed form to our office before the deadline. At the same time, you'll want to set up the HSA component. So that's the health savings account, and that's done. The process is basically administered in some part within our office. We take the form and we submit that form to our third-party administrator, who's Basic Pacific. So you'll fill out that form, bring it into our office, again, original completed form, and we will review that and send that over to Basic Pacific, our third-party administrator, who will set up the HSA. Once we've confirmed that the HSA account is active and you're able to receive contributions toward it, we'll basically set up in our system accordingly.
Okay, so as promised, now what I would like to do is to show you the calculators that we have prepared that help you look at the risk reward of the high deductible plan compared to the traditional HMO plans. Now, I'm going to go through these pretty slowly because the idea is that, some of the feedback that we got is that reminding you that this is going to be recorded. So thinking that if you are going to be using this calculator, you would be able to have this calculator open at the same time that you are watching the video recording and be able to follow along. Now, if you're interested in this calculator, you could send me an email and I will send you the calculator that is appropriate for whatever unit you're in. So send me an email letting me know that you would like the HDHP cost savings calculator, and also let me know which unit you're in and I will send it over to you. We have the same disclaimer in here that we also had on the slides that this is meant for informational purposes. There are so many different things that could come into play when you're looking at a high deductible health plan and a health savings account that there is no way we could capture everything in this calculator. So this is just a big picture tool for you to use. And of course, it's just based on estimates. So your actual situation could significantly vary from the results of your initial estimation that you do here. With that said, the yellow areas on this Excel spreadsheet, those are the areas that you are going to want to complete. The first, everything else that's in gray is automatically going to update based on how you answer the questions in the yellow boxes. So you could see here, the first thing that I want to do is select the carrier that I want to use for comparison. And I'm going to select Kaiser. You could see that down here now some of the information filled in. So my monthly employee premium contribution for a traditional HMO filled in right here for a Kaiser plan. And it doesn't matter whether I'm an individual or a family member or a family plan yet, because of the fact that we have a composite rate, meaning that you pay the same premium no matter if you're in an individual plan or a family plan. And you could see here that it calculated for me that I have no monthly employee premium for the high deductible health plans, because remember, the employer covers your full premium for the high deductible health plan. Now the next thing I'm going to select in here is that I'm a family in this example. So then you could see now something else changed down here. And what changed is it gave my employer contribution to my employee HSA account. So because I put that I'm in a family plan, I get $150 this year each month contributed to my HSA account. Once again, that's assuming that I'm eligible for an HSA account and I already have one set up with Basic Pacific. And so then that multiplies by 12 months. And so I'm going to get annually, I'm going to get $1,800 into my HSA. So then next, for Paul's favorite part, is the taxes. So we want this calculator to be able to calculate the tax costs and savings related to these plans. So over here you could see that there's tabs that have the tax rates. And in here in the red, those are your marginal tax rates. So you'll look here, you'll look on your tax return, you'll find where your taxable income is on your tax return and adjust that for what you think your taxable income is going to be for the year that you're analyzing. And then you're going to find your marginal tax rate over here in red. and you're going to go back to your calculator and you're going to type in those numbers. So I'm just going to put some hypothetical numbers in here. Okay. Now the next yellow area that I have to figure out is how much I want to contribute to my HSA if I decide to go with a high deductible health plan. You could see already that I have $1,800. So this is the total annual HSA contribution. So remember that that's employee plus employer. So I already have $1,800 that's going to go in there. And over here you can see that the maximum that I could do for a family is $7,000. So I could decide which, the few people that we've talked to that have these HSAs, say what they do is they just contribute what their premium would have been if they were on the traditional HMO. That's what they just decide to contribute monthly. Or other people say, I'm going to go ahead, I have some additional money that I would like to set aside. I'm going to go ahead and contribute up to my maximum of $7,000 this year. So in this example, I'm going to say that I want to build up my HSA account, so I'm going to contribute the additional $5,200 here, and that gets me to my $7,000 maximum that I can do for family coverage. You could see down here some additional gray information calculated in here to get me some of the tax rates that I need for my tax savings. So now going down this calculator, I could see that I don't have everything on the top section is gray, so I don't have to do anything else. So before I get to any of my medical costs, I could see that my outflow for the traditional HMO plan right now for the year is going to be $2,968. But for my high deductible health plan, I have an inflow of money right now, $1,800. So if you look at the money that I'm saving by not being on a traditional HMO, plus the money that I'm earning for in my high deductible health plan, I'm at a positive high deductible health plan reward of $4,768 before I get to my medical costs. But of course I have to take in the medical costs into consideration. Now this is what I estimate that my medical costs are going to be for the year. This is the part where it gets a little bit tricky. And this is where, as Nicole mentioned, you can go onto all of the carrier websites and you can look to see what the costs are of the services that you might be anticipating that you're going to need for that year. The costs, they have disclaimers all over that the costs are just estimates. Kaiser actually has quite a few tools where they can analyze you as an individual of the types, your age and the types of services that you've had in the past, and it can estimate what they think that your costs are going to be. I know the other plans have those estimators too. So it's really important to get in touch with your carrier, utilize the website to be able to figure out what your out-of-pocket costs would be if you were on a high deductible health plan. So in this scenario, I'm going to, and all these numbers here have to be input as negative. You see that warning over there that says input as negative, because these are all cash outflows. So I'm going to say in this scenario that my family, it pays $15 co-pays, and they're going to have about 10 visits each year that are non-preventative, is what I'm estimating there. So I'm going to have about $150 worth of co-pays if I was on a traditional HMO. And then this here is if you have any limits or exclusions, any costs that are not covered by my HMO. So I'm going to say, no, I don't think I'm going to have any of those. So I'm going to put a 0 there. Now I'm going to estimate what my high deductible health plan deductibles are going to be. So remember, I'm in a family plan. That drop-down menu tells you what the maximums are for each of the plans. So my max deductible is $3,600. So I'm going to say that just to look at my worst case scenario, I'm going to say that I hit my deductible. So I'm going to put in a negative $3,600. Then do I have any other costs after I reach my deductible? remembering that I'm in Kaiser, so the only out-of-pocket costs that I would have to reach after my deductible are going to be for prescriptions. So and it's only the copays. I don't have to pay the full cost of the prescriptions, just copays. So I'm just going to estimate here that that's 0. Give myself a break on that. And limits or exclusion, I'm not going to have any there. So now you could see this continues to calculate my risk reward. I'm still at a positive reward over here for the high deductible health plan. So I'm still at a positive cash inflow of $1,318. So even with reaching my max deductible, I'm still in the positive with my high deductible health plan. Now to get to the fun part, the tax savings. Luckily, we built all these calculations in for you already, so you don't have to calculate any of this. This is all estimated based on your estimated marginal tax rate that you input up there earlier. So you could see here the tax benefits. I'm going to have an additional tax savings of $442 with the high deductible reward. So at the end of the day, I'm going to be in the positive of $1,758 reward from doing the high deductible health plan. So over here, my outflow would have been $1,665. Over here, I would have still had an inflow of $94 when you take all of those factors into consideration. Then I added a few other calculators down here just so you could track some things. If you have an HSA account, this doesn't include any of the earnings that you could be earning on your HSA account, but this kind of just shows you, for planning purposes, how much money you might want to put into your HSA. So if I have a 0 beginning balance, and then if I had any other costs that I paid out of my HSA, I could put those there. So this shows you at the end of the day, at the end of this year, I still have $3,400 left in my HSA account after I paid the $3,600. That's because I maxed out my employee HSA contributions, plus I had the employer, so I still have $3,400. And then down here just shows you your cash flows, just so you can see the actual cash that's going to be coming out of your checking account, and then also looking at your cash flow into your HSA account. So that is, I know that this isn't the easiest thing to review, but hopefully you're able to use this calculator along maybe with a video next to it to be able to try to figure this out yourself. And of course, if you have any questions, you can always ask one of us as well. Now this is where it gets a little bit more complicated because of the first year risk that we have. So I'm going to go through this again, but I'm going to show you how this works, because you can see I have another tab here for the first year calculator. So the first thing I'm going to do is I'm going to try to keep my assumptions the same here. I do Kaiser, and I'm going to select family. My marginal tax rate federal, I'm assuming 32, doing a hypothetical state, 9.2. I'm going to do $5,200. I'm going to assume in this example, so if you see down here, there's an area where you can adjust the months if you have an FSA for your first year. So you could change this. If you're in Nicole's position, you would have to change this to 6 months, because you're only going to be getting 6 months worth of employer contributions into your HSA. So that's why that area, one area that you're going to have to adjust for the first year. I'm going to do the same thing here. Assume that I have $150 worth of copays under the traditional. Now you can see this is where the difference is. We broke out your deductibles for the first 6 months and the second 6 months, remembering that the high deductible health plan runs on a calendar year, and it resets in January. So I'm at risk of reaching that $3,600 deductible twice in my first year. And I'm going to assume again that I don't have any other out-of-pockets. And let's assume the second year I'm not as unlucky, and maybe let's say the second year I only have $2,000 in costs, so I don't reach the max deductible. So you could see here that my reward is now a risk. So I'm at a financial risk for the first year of $682. Going down to the tax, I'm at risk of losing $2,400 or $241 of the high deductible for the first year. But remembering that you might want to look at this as a long-term tool, that I might lose out on my high deductible plan for the first year, but then you also saw my example in the next year where I'm slowly going to be making up any of that negative outflow that I might have had. The rest of this calculator is going to remain the same, so I'm going to skip that part of it. I know that we've reached our time with you, so but we will continue to answer any questions that are here for an extra 5 minutes. Once again, if you have to sign off now, I just wanted to remind you that this is recorded and will be available for viewing later on the Employee Benefits website. I will find a way to communicate that out to everybody to let you know where that's placed. And if you need any of these calculators, send me an email and I'll be happy to send them to you. If you want a copy of the slides, I could send those to you as well. For those that have to sign out, thank you for joining us. For those that can remain signed in, we'll answer some of your questions now.